Good morning, dear students. So we are going to discuss cerebrum, sulci, gyri and functional areas, and we are going to see the details of this. It's a very important essay question. Okay. So the sulci, gyri we will see on different surfaces of the brain like superolateral surface, medial surface and inferior surface. Simultaneously, we are also going to cover the functional areas like motor areas, sensory areas, the psychical areas, and what happens if there is any damage to these functional areas. Nothing but the lesions. Okay? Now, when generally, like when you talk about the development, like the cerebrum is the largest part of the forebrain, which is highly developed in human beings, which is derived from telencephalon. So we have two cerebral hemispheres, right and left cerebral hemispheres, which are incompletely separated by means of this median or the longitudinal fissure. So the place where the right and left cerebral hemispheres are connected, the area is called corpus callosum. Now when you just look at the cerebrum, so it has like the presenting parts of the cerebrum, each cerebral hemisphere has 3 poles. Okay. So it has 3 surfaces, 3 borders and 6 lobes. Let us see one by one. So when you talk about 3 poles, now this is the anterior end of the brain, this is the posterior end of the brain. Okay, so we have towards the frontal bone, the pole is the frontal pole, and towards the occipital bone, we have occipital pole, and then towards the temporal bone, that we have temporal lobe, and the most pointed part is the temporal pole. So the names of the like lobes of the brain are also named according to the place of the bone under which it is lying. Below frontal bone, we have frontal lobe. Below occipital bone, we have occipital lobe. Below temporal bone, we have temporal lobe of the cerebrum. Okay. Then coming to the superolateral surface. So overall, if you see from the side of the brain, you call this surface as superolateral surface. If you see from the cut section of the brain, median sagittal section, this surface of the brain is medial surface. If you view the brain from down, from inferior aspect, we call it as inferior surface. The inferior surface is further subdivided into orbital surface and tentorial surface. Okay. Then the brain has 3 borders, like the border which is running from the frontal pole to the occipital pole, completely dividing the brain into right and left cerebral hemispheres. So this border is superomedial border. Okay. Then the other border we have is this one, which is present inferiorly and laterally. We call it as inferolateral border. Okay, anterior 1/3 of the superciliary border. Then we have one more border which is present inferiorly and medially. We call this border as inferomedial border. So anterior 1/3 of the medial orbital, middle 1/3. This all you will understand once we are done with the inferior surface sulci gyri. You will understand these terms. You can revise the like lecture going back, and you can just read this point like inferomedial border is formed by anterior 1/3 of the medial orbital border, middle 1/3 of the hippocampal border, and posterior 1/3 of the medial occipital border. Okay. Then, now coming to the lobes of the brain, we have frontal lobe, parietal lobe, occipital lobe, temporal lobe related to the names of the bones under which the brain is lying. Now, apart from this, there is one more lobe which is hidden between the 2 lobes. What are these? Frontal and temporal. Here we have lateral sulcus. If you retract, there will be one hidden lobe which is insular lobe, also called as island of Rheel on the superolateral surface. And on the medial surface, we have one more lobe which is called as limbic lobe. Okay. Now this is the medial surface, this is the superolateral surface. On the medial surface connecting right and left cerebral hemisphere, we have a structure which is called as corpus callosum. Okay, then now we are going to discuss the sulci and gyri. Before we go to sulci and gyri, now let us see the major sulci which divides the cerebrum into 4 lobes. The first sulcus what we are finding between the frontal lobe and parietal lobe is the central sulcus. And the sulcus which is present between frontal lobe and temporal lobe, this is lateral sulcus. Then the sulcus which is between parietal lobe and occipital lobe, it's parieto-occipital sulcus. Okay, now there is one notch which is like around 5 centimeters in front of this occipital pole. You call this notch as pre-occipital notch. So actually parieto-occipital sulcus is not a complete sulcus. If you just draw one line, imaginary, which is going upwards and touching the parieto-occipital sulcus, and if you again extend one line extending from the lateral sulcus to the parieto-occipital sulcus, so this imaginary plane of these two lines, inverted L-shaped line, will divide the brain completely into these 4 lobes, the frontal, parietal, temporal, and occipital. Okay. Now, in this picture, we are able to see the superolateral surface. On the superolateral surface, see the depressions are called as sulci, in singular is sulcus, and all together these depressions are called as sulci, and the elevations are called as gyri. Okay. Now, if you see these black empty areas, whatever you are finding, these are all sulci, and these elevated areas in between these, suppose this is one sulcus, this is one sulcus. Area between the two sulci, we call it as gyri. Okay. Now, on the superolateral surface, actually, I will take you to this table once I give you the basic information. Now see here, on the superolateral surface, we have one chief sulcus which divides the frontal lobe from the parietal lobe. You call this sulcus as central sulcus. Okay. Now let us talk about the frontal lobe, sulci gyri here. So in front of the central sulcus, the name of the sulcus is pre-central sulcus. Pre-central sulcus. Now, you will see within the frontal lobe, we also have the other 2 sulci, that is the superior frontal sulcus and inferior frontal sulcus. Okay. Now, we know this is the lateral sulcus, right? So, from the stem of the lateral sulcus, you are finding 2 lines are actually, 2 sulci are actually extending into the frontal lobe. So, these are actually called as the horizontal ramus of the lateral sulcus and ascending ramus of the lateral sulcus. Now, once you know this picture of the frontal lobe, now let us talk about the gyri. Once you know the sulci, now between the central sulcus and pre-central sulcus, this area is called pre-central gyrus. Pre-central gyrus. Now, now see here between these 2 lines, what are the superior frontal sulcus and inferior frontal sulcus? We have 3 gyri. What are those? Superior frontal gyrus, middle frontal gyrus, and inferior frontal gyrus. Okay, and this is the stem of the lateral sulcus. So now the inferior frontal gyrus has been subdivided into 3 areas by means of this ascending ramus and the horizontal ramus. The 3 areas are pars opercularis, pars triangularis, and pars orbitalis. Okay, so these are the various sulci and gyri what you see on the superolateral surface, especially in the frontal lobe. Okay, once you know this, now see here, the same thing has been given in Chaurassia's neuroanatomy book. So one thing I want to tell you, you can study like neuroanatomy from the prescribed books and even in Chaurassia textbook. So this topic is good. Many of the topics are good in Chaurassia's neuroanatomy book, but if you have any other book also, that is fine. So this table I have taken from Chaurassia. Now in this, you can see the frontal lobe, the sulci, we have pre-central sulcus. Now, between the central and precentral sulci, we have the precentral gyrus. Between superior frontal and inferior frontal sulci, we have superior frontal gyrus, middle frontal gyrus, and inferior frontal gyrus. I said inferior frontal gyrus, we have anterior horizontal and anterior ascending rami of lateral sulcus, which divides this into three areas: pars orbitalis, pars triangularis, and pars opercularis. So this is what we have seen in the frontal lobe. Now let us come to the parietal lobe. Now in the parietal lobe, behind the central sulcus, the name of the sulcus is post-central sulcus. So within this parietal lobe, you are finding there is one sulcus again, you call it as intraparietal sulcus. Now, let us see the gyri. Between the central and post-central sulcus, the area is called post-central gyrus. And above intraparietal sulcus, the area is superior parietal lobule. Below intraparietal sulcus, this area is inferior parietal lobule. And in the inferior parietal lobule, if you observe, the middle temporal gyrus and the actually inferior temporal gyrus and sulci, they are actually extending. Now, to talk in detail about this parietal lobe, again you can go in the tabular form like this. So, the various sulci we have seen, post-central sulcus and intraparietal sulcus. So, we have post-central gyrus, superior parietal lobule and inferior parietal lobule. So, here we will see this area is divided into three parts by anterior supramarginal gyrus, then middle angular gyrus, and posterior over the upturned area of inferior temporal sulcus. Okay. Then now let us go to the temporal pole. Very simple. The one which is shown in violet color is the temporal pole. So in this temporal pole, we have two sulci. Like what are those? Like we have superior temporal sulcus and then we have inferior temporal sulcus. Now between these two sulci, we have three simple gyri, simple names: superior temporal gyrus, middle temporal gyrus, and inferior temporal gyrus. Okay. Now, let us see in the tabular form as well. So temporal lobe, we have superior temporal sulcus, inferior temporal gyrus, superior middle and inferior temporal gyri. Now coming to the occipital lobe. So in the occipital lobe, we have the sulci like there is one lateral occipital sulcus. Actually, there will be a part of calcarine sulcus also. Okay. So let us see what are the various sulci gyri here. In the occipital lobe, we have transverse occipital sulcus. Then we have lateral occipital sulcus, lunate sulcus, superior and inferior polar sulci, and calcarine sulcus. So related to these sulci, we have gyri like arcus parieto-occipitalis, superior occipital gyrus, inferior occipital gyrus, and gyrus descendens. So superolateral surface of the cerebrum is usual essay question. Suppose if this essay question comes, you can just give this table by drawing a well-labeled picture like this. This picture is showing us all sulci and gyri. Okay. In this slide, you can actually see simultaneously the points and also the picture, so which makes your learning easy. So you can see here, like on the superolateral surface, the upturned ends of the posterior ramus of the lateral sulcus, this one, and the superior and inferior temporal sulcus. So this part will divide the parietal lobe, the inferior parietal lobule, into three areas. So here it is labeled supramarginal gyrus, angular gyrus, and arcus temporo-occipitalis. Okay. So temporal lobe also we have seen, then occipital lobe. So you can see here, this is the lunate sulcus. You can see post-calcarine sulcus and lateral occipital sulcus. They are clearly shown here. So the lateral occipital sulcus will divide the occipital lobe into superior occipital gyrus and inferior occipital gyrus. Okay. So this is this picture has been taken from Netter's Atlas And the human brain really also looks like this. So where you have the central sulcus, precentral sulcus, postcentral sulcus, and superior frontal sulcus, inferior frontal sulcus, lateral sulcus, all these sulci, gyri, whatever we have seen. So similar things we will be seeing in the human brain as well. Okay, which are arbitrary, of course. Now coming to the sulci and gyri on the medial side. So on the medial side, see, we come across this structure which is connecting right and left cerebral hemispheres. We call this as the corpus callosum. Okay. So here we have still closer picture of the medial surface. Now we have to be very much clear about which is the anterior and posterior ends when you see the medial surface, which can be actually ruled out by looking at the parts of corpus callosum. Corpus callosum we are going to discuss separately when we study the white matter of the cerebrum. So corpus callosum is the largest commissural fiber which is connecting right and left cerebral hemispheres. This is the anterior end where we have rostrum. This bend is called as genu, and whole of this is body, and behind we have splenium. So these parts of the corpus callosum will help us to understand this is the anterior end of the cerebrum. That means this is the frontal lobe. Behind the central sulcus, this is the parietal lobe, and of course colors are also same for your easy understanding. Behind we have the occipital lobe, and this is the temporal lobe. Okay, now immediately above corpus callosum, there is a sulcus which is called as callosal sulcus. Okay, then the area above the callosal sulcus is the cingulate gyrus. Now we know this area is frontal lobe, this area is parietal. We know already we have central sulcus here, precentral sulcus, postcentral sulcus. So this whole area which is surrounding the central sulcus is actually called as paracentral lobule. Paracentral lobule. Okay. And the area which is above callosal sulcus, you call it as cingulate sulcus. So actually between the cingulate sulcus and the callosal sulcus, we have cingulate gyrus. Whole of the medial surface of the frontal lobe superiorly is named as medial frontal gyrus. Medial frontal gyrus. So now this is the temporal lobe, isn't it? So in the temporal lobe, the other sulci and gyri what we see on the medial surface, one is the collateral sulcus, and then we have occipitotemporal sulcus. Now above occipitotemporal sulcus, the gyrus is medial occipitotemporal gyrus. Below we have lateral occipitotemporal gyrus. Okay. Now, right in front of the rostrum of corpus callosum, the area is paraterminal gyrus. Okay, then. So this is the collateral sulcus, and parahippocampal gyrus we will see further much clearly when we do inferior surface of the cerebrum, inferior view. Okay, then behind the splenium of the corpus callosum, we have a sulcus which is called suprasplenial sulcus. Then we already know, like between the parietal and occipital lobe, the sulcus is parieto-occipital sulcus, and this is the parietal lobe, and here you are finding this area is precuneus. Behind the parieto-occipital sulcus, you call it as cuneus, precuneus and cuneus. Calcarine sulcus is very clearly defined on the medial surface of the cerebrum. It is not very well defined in the previous picture of superolateral surface of cerebrum. Okay. So above calcarine sulcus, the part of the occipital lobe is actually called as cuneus. Okay. And in front of the parieto-occipital sulcus, we have isthmus. Okay. So these are the various labelings which you should draw in practice. Okay. Now let us go to the table what we have been seeing, which will make our learning easy. So keep that picture in mind, and on the medial side we have anterior para-olfactory, posterior para. These are all sulci and these are the gyri. You can see sulcus and gyrus on the medial side. We have cingulate sulcus, callosal sulcus, like suprasplenial or subparietal sulcus, parieto-occipital and calcarine sulcus. Related to that, we have like paraterminal gyrus, para-olfactory gyrus, cingulate is related to medial frontal. Then we have paracentral lobule, cingulate gyrus, and cuneus and precuneus. Everything I have shown you. Okay. In this picture also simultaneously you can see this is our callosal sulcus, this one immediately above corpus callosum. We know this is callosal sulcus. Okay, and we know this area is cingulate sulcus, and in between them the area is cingulate gyrus. Okay, then this area is medial frontal gyrus. Okay, surrounding the central sulcus, PCL is nothing but paracentral lobule. Okay, there we have higher centers. We will see the functional areas. I hope you have also learned in physiology. Okay, then anterior and posterior like para-olfactory sulcus is there. Okay, then anterior and posterior para-olfactory sulcus. Okay, then so like related to this we can see paraterminal gyrus and also para-olfactory gyrus. So here the picture is very much clear. You can pause the video and just practice this and see what are the labelings given and learn simultaneously. Okay, then the other sulci what we see, we have like suprasplenial sulcus, then we have parieto-occipital sulcus, calcarine sulcus. Okay, this area between the parieto-occipital sulcus and the calcarine sulcus we have cuneus, isn't it? Above parieto-occipital sulcus we have precuneus. Okay, and this area, narrow region between splenium and calcarine sulcus is isthmus. So isthmus, as you can see here. Okay, then now coming to the inferior aspect. So on the inferior aspect again I will take you to a different picture. This is the inferior view of the brain, that is the two cerebral hemispheres. Now on the inferior surface you can see different colors have been used again for our convenience. We know this orange color we have been using for frontal lobe, this is for temporal lobe, and this is for occipital lobe. Now see the area what we have here on the inferior aspect of the frontal lobe, we have this area is actually the orbital part of the inferior surface. Remaining temporal and the occipital part is the tentorial part what we have. So on the inferior surface we have orbital part and tentorial part. Orbital part is the orange area, that is the frontal lobes. Tentorial part is nothing but this violet area and yellow area, which is nothing but temporal and occipital lobes contribution. Okay, then when you see the inferior aspect of the frontal lobe, we will come across the olfactory bulb, which is the first cranial nerve. Olfactory tract, nothing but the olfactory nerve. It has like medial and lateral stria, which are named here. Between the medial and lateral stria, you are finding certain holes, which is called as anterior perforated substance. So if you lift this olfactory bulb, there will be a sulcus, which is called as rhinal sulcus. Okay, and the area here you will call it as gyrus rectus. Rectus means straight. Rectus abdominis muscle, that means straight. Rectus, rectum is straight. Rectus word indicates it is straight, right? Okay, then on the lateral aspect of the olfactory tract, you have head-shaped sulcus. So this head-shaped sulcus is having certain gyri. In front you call it as anterior orbital gyrus. Behind you call it as posterior orbital gyrus. Near to the midline we call it as medial orbital gyrus. On lateral side you call it as lateral orbital gyrus. Okay, then now these are the sulci gyri what you see in the orbital part of the inferior surface. Then we have tentorial part. On the tentorial part, we have sulci like rhinal sulcus. Then we have this sulcus is collateral sulcus, adjacent to which we have occipitotemporal sulcus. Okay, then now let us see the various gyri. So now the area which is medial to rhinal sulcus is uncus. This word we have studied when we were doing cavernous sinus, isn't it? Laterally, it is related to the uncus, which is a part of temporal lobe of brain. I then said, and I told you I will help you to recollect it. Okay, then see, medial to this collateral sulcus, the area is parahippocampal gyrus. Between the collateral sulcus and occipitotemporal sulcus, we have medial occipitotemporal gyrus on the medial side, lateral occipitotemporal gyrus on the lateral side. Okay, this border which we see on the inferior aspect is medial occipital border. Okay, then this is the cut section of midbrain. So these are the various sulci and gyri what we see on the inferior aspect. Now let us see on the inferior aspect, like what are the sulci gyri? We have the, I told you this side we have sulci and this side we have gyri. So on the inferior surface we have olfactory sulcus, below that olfactory bulb and olfactory tract. Okay, then we have head-shaped orbital sulcus, collateral sulcus, rhinal sulcus and occipitotemporal sulcus. The related gyri I have shown you, gyrus rectus, anterior, posterior, medial, lateral, orbital gyri related to H-shaped orbital sulcus, then lingula, uncus, parahippocampal gyrus, medial and lateral occipitotemporal gyri. Okay, so see, this is nothing but the olfactory sulcus and the area medial to is gyrus rectus. This is head-shaped orbital sulcus and we know the associated names anterior, posterior, medial, lateral, occipital gyri, orbital gyri. Okay, that was our orbital part, right? This whole area is orbital part and remaining area is tentorial part. So in the tentorial part, we have, this is the collateral sulcus, okay, which is medially situated. Then we have occipitotemporal sulcus, which is laterally situated. Then on medial side, we have medial occipitotemporal gyrus. This area is lateral occipitotemporal gyrus. So then we have this sulcus is rhinal sulcus, medial to which we have uncus. As you come down, we have parahippocampal gyrus. Okay, and then as you come down, we have lingual gyrus. So these are the gyri and sulci what we see on the inferior surface of the brain on the tentorial part. Behind the stem of lateral sulcus is the tentorial part. In front we have orbital part. So these two parts together we see on the inferior surface of brain. Okay. So before we go to functional areas, now before we go to functional areas, now let us also try to see, like I said, this is the lateral sulcus. If you just open this lateral sulcus, you will see there is one hidden lobe. This hidden lobe is the fifth lobe, which is insula, island of Rheel. It itself can be a 3 marks or 5 marks question, insula. So insula lies deep in the floor of the lateral fissure, surrounded by circular sulcus and overlapped by adjacent cortical areas. So these lips which we have retracted, they are actually called as opercula, operculum. We have parietal operculum, then we have temporal operculum. So this side you will have parietal operculum and this side we have temporal operculum. Operculum means lids. When you retract these two lids, the underlying deep hidden lobe is nothing but insula. The role of anterior insular cortex is it helps in olfaction and also taste, and posterior insular cortex is helping in language. So if you just observe this insular region, here also we have many sulci and gyri. Okay, if they are long in size, we call them as gyra longa. If they are small in size, they are called as gyri brevidia. Okay. So you can see this is the central sulcus here, and this is the lateral sulcus. Okay, central sulcus is also called as central sulcus of Rolando. And you see here, just wanted to show you this insula. You have actually separated the two opercula, isn't it? See, the hidden portion of cortex in the depths of the lateral sulcus. You are finding this triangular in shape. We have gyri longae and gyri brevia. This is the way you have to retract the lips of the lateral sulcus in order to see this hidden lobe, that is insula. Now let us see the various functional areas what we see in relation to the sulci and gyri. We have 52 such Brodmann's mapping Brodmann's areas in the cerebral cortex. Okay, so three types of functional areas we have classified them as motor areas. Okay, then we have sensory area, and then we have association areas. Okay, so everything is numbered. Now see here, the primary motor area, which is area number 4. It is present in the precentral gyrus on the superolateral surface, and our body's representation is motor homunculus, that is body's representation is upside down, and it controls voluntary movements of the contralateral side. Okay, then so suppose if this motor area, which is basically giving the motor tracts, if you remember the pyramidal tracts, which are actually moving downwards. So suppose if there is any lesion in this primary motor area, you will see there will be contralateral paralysis. Okay, so that is contralateral flaccid paralysis and positive Babinski sign. The other areas we see in Neuro are premotor area. In front of the motor area, area number 4, we have premotor area, area number 6 and 8. So 6 is responsible for skillful acts, programming of movements. Upper part of area number 6 is writing area. Area number 8 is also known as frontal eye field, regulates voluntary conjugate movements of eyeball. Okay, then we have supplementary motor area, continuous with the area number 6 on medial surface. So function is it controls complex movements. It elicits an urge to move. Suppose if there is any lesion in this supplementary motor area, it will lead to akinesia, where lack of movement is there, and the paralysis is upper motor neuron type of paralysis, conjoint lesion of primary motor, premotor and supplementary motor area together. Then next we have prefrontal area, area number 9 and area number 12. Okay, so in front of the premotor area, highly developed in human beings. So functions of this prefrontal area is it regulates the depth of feeling, abstract thinking, mature judgment, foresight and tactfulness. So silent area of the brain is prefrontal area number 9 to 12. Then once we are done with the frontal lobe, now let us go to the parietal lobe and see the functional areas there. So in the sensory area we have in the post-central gyrus. Okay, so we have primary sensory area, then we have secondary sensory area. Okay, then we have sensory association and higher association areas. Now coming to the primary sensory area, so here we have somesthetic area, visual area and auditory area. Now somesthetic area, primary somesthetic area is area number 312, what we see in the post-central gyrus. So on the superolateral surface of the brain. So area number 312 is responsible for localizing and analyzing, discriminating different modalities of cutaneous senses. It is sensory area, right? Hence it is perceiving touch, pressure, position and vibration sense. Here this is the body's representation of sensory homunculus. Sensations are somatotopically arranged. lower part of the post-central gyrus. You can see here the number. Here we have the number 43. Okay, so which is actually the taste area. Then on the medial surface of the brain, if you remember me telling you this is paracentral lobule. Okay, so here also we are finding area number 4, motor area, and 312, primary somesthetic area, right? So this paracentral lobule receives sense of distension of urinary bladder and rectum. Okay, then secondary somesthetic areas, that is supplementary areas, upper lip of the posterior ramus of the lateral sulcus, this area. Okay, and lower part of the pre and post central sulcus. Okay, pre-central sulcus and post-central, this particular area we have, which receives pain sensation and other modalities of cutaneous sensation. Okay, then the other somesthetic association areas are area number 5 and area number 7 behind the post-central gyrus. Okay, superior parietal lobule, nothing but. Then the higher association area for somesthetic senses, area number 40, supramarginal gyrus, is richly connected to the areas, area number 5 and 7. So here the lesion at 40, area number 40, will lead to tactile agnosia. That means person, if we are able to identify something, like if you hold a cell phone, somebody gives you after closing your eyes, you will be just by looking at the texture and the shape and size, you will identify it as a phone, right? So that is, if that sensation is lost, you call it as astereognosis. Okay, touch that is gone, that is tactile aphasia if the area number 40 is damaged. Then we have visual senses. They are specially situated in the occipital lobe. We have primary visual area, area number 17. Then we have visual association areas like area number 18 and 19. We have higher visual association area, area number 39. Okay, then visual association areas, area number 18 and 19. They are situated at parastriate, also called as parastriate areas and peristriate areas. Okay, then function of these areas 18 and para is actually very close to area number 17. Then peri is little away from the surrounding is peri, right? Hence it is named as peristriate and this is named as parastriate. Okay, so they are, this is all related to area number 17, which is the chief visual area. Okay, 17 is chief visual area and very close to area number 17 we have like parastriate area, and a little away we have peristriate area. The area number 18 and 19, which are actually occipital eye field areas, they help in like mediating conjugate movements of eyeball, involuntary type of movements. Then we have auditory senses, primary auditory area, area number 41, auditory association area, area number 42, higher auditory association area, area number 22. Then we have psychical cortex, like anterior part of the temporal lobe, which is basically responsible for memory of present and past, dreams, hallucination, auditory and visual. Okay. Now, speech function is performed by left cerebral hemisphere regardless of hand preference. Hence, left hemisphere is dominant or talking brain. Right hemisphere is non-dominant, you call it as mute brain. Then, speech function, like area number 22, dominant hemisphere has 4 speech centers. We have 3 sensory and 1 motor. Sensory speech areas are area number 22, which is higher auditory association vernix area. We have area number 39, higher visual association area. Area number 40, higher association area for somesthetic senses. Then motor speech areas It's very, very important. Broca's area. It itself can come as a 3 marks question. So area number 44 and 45, which is basically controlling the motor speech centers. Motor and sensory may be transferred to right hemisphere in child up to 6 to 8 years in case of cerebral injury. Then next, like area number 22, 39, 40 receives input from hearing, vision and touch. Okay. So 22, 39 and 40. 22 is this area, that is the occipital lobe, that is visual area. This 22 is receiving from temporal lobe, auditory area. 40 is somesthetic senses. So area number 22, 39 and 40 receives inputs from hearing, okay, temporal lobe, vision, occipital lobe, touch and proprioception from the somesthetic areas. So information processed in area number 22, okay, and projected to Broca's area through arcuate fasciculus, that is the bundle of nerve fibers. Then lesions of the speech center, it involves the speech center, that is the dominant hemisphere. It leads to a condition like aphasia, that means person will not be able to speak. Okay, then so sensory aphasia we have and motor aphasia, both are there. So conduct aphasia, lesions of arcuate fasciculus. So the person will be losing fluency, comprehension is intact, repetition of spoken language is extremely difficult. So now before we go to summary, I'll take you to one table again. I want every one of you to practice these diagrams of the superolateral surface where we are shown functional areas. Okay, in the pre-central gyrus, we have area number 4, co-central gyrus. We have area number 2, 1, 3. In the frontal lobe, we have area number 6, 8, that is the premotor area, frontal eye field, motor speech area, Broca's area. In auditory area, we have 41, 42. Please practice all these like visual area. Primary visual area, area number 17, 18, 19 visual association areas. Okay, sensory speech area is Wernicke's area, motor speech area is Broca's area. Okay, like that we have all like somesthetic areas are 2, 1, 3, isn't it? So these are the areas, functional areas on which surface, whenever you see corpus callosum, you have to identify this surface as medial surface. So this is the rostrum part, hence this is the frontal lobe, this is parietal lobe, this is occipital lobe, and this is the temporal lobe. So please check the functional areas, please practice this diagram. Okay, and what I want everybody to learn is, this is the sensory and motor homunculus. You are finding the body's representation, the sensory homunculus. Then easiest way of learning all these functional areas is to practice this table again, which I have taken from BDC, Chaurasia. Okay, so here you are finding frontal lobe, we have seen all these functional areas, motor area number 4 we saw. Okay, motor area number 4, where do we have? Like pre-central gyrus and paracentral lobule, and body's representation is upside down except face. So this frontal motor area is controlling voluntary activities of the opposite half of the body. Suppose if this functional area, area number 4 is damaged, you will see contralateral paralysis and fits, epilepsy, which are called as Jacksonian fits. We have seen premotor area number 6, right, in the frontal lobe. So which is situated in the posterior parts of superior, middle and inferior frontal gyri. Okay, it controls the extrapyramidal system, often mixed. Suppose if this is damaged, person will have mixed pyramidal effects. So like that we have frontal eye field, area number 6 and 8, present in the posterior part of the middle frontal gyrus, controls the horizontal conjugate movements of eyes. This everything I have shown. This is only the summary I am showing you this way. And suppose if this area, frontal eye field is damaged, horizontal conjugate movements of eyeball are lost. Motor speech area is Broca's area, area number 44, 45, situated in pars triangularis and pars opercularis. It controls the spoken speech. Suppose if this area is damaged, person will not be able to speak, you call it as motor aphasia. Prefrontal area number 9, 10, 11, 12, remaining larger anterior part of the frontal lobe. It controls emotions, concentration, attention, and initiative and judgment. Suppose if prefrontal cortex is damaged, person will lose the orientation. Okay, then we are coming to the next lobe, parietal lobe. In the parietal lobe, we have somesthetic, our chief sensory area number 312, situated in the post-central gyrus and paracentral lobule. Upside down is the representation of body except face. Function is perception of exteroceptive touch, pain and temperature, and proprioceptive impulses. Suppose if this area is damaged, there is loss of appreciation of impulses received. Sensory association area, that is Wernicke's area. This is motor speech and this is sensory speech area. Area number 40, inferior part of the parietal lobule. Suppose this is controlling sensory speech, and if it is damaged sensory, aphasia, person will not be able to speak. Area number 5, 7, between sensory and visual areas. So it is responsible for identifying the object with closed eyes. You call it as stereognosis. And suppose if this is damaged, then astereognosis and sensory aphasia. Okay, occipital lobe, we have visual sensory areas, area number 17, in and around the post-calcarine sulcus. Okay, then here you will see macular areas has largest representation. The function is reception and perception of isolated visual impressions of color, size, form. That means it is the chief visual sensory area. Suppose if this area is damaged, then person will have homonymous hemianopia with macular sparing. Then visual psychic areas are parastriate and peristriate areas, which I have shown, area number 18 and 19, surrounding the area number 17, that is the striate area. Suppose it is basically helping in the correlation of visual impulses with past memory, recognition of objects seen in the past. As you identify some movie after watching 2 minutes movie, yes, I have already seen this movie, something like that. That is the visual psychic area. Okay, suppose if this area is damaged, person will have visual agnosia. He cannot identify, will not have any past memory of vision. Then we have temporal lobe, where we have auditosensory areas number 41 and 42, situated in the posterior part of superior temporal gyrus and anterior transverse temporal gyrus. Function is reception and perception of isolated auditory impressions of loudness, quality of pitch. Suppose if this area is damaged, it will lead to impaired hearing. Next, area number 22, audito-psychic area, which is resting on superior temporal gyrus. Function is correlation of auditory impressions with past memory and identification of sounds heard. Suppose if this area is damaged, it will lead to auditory agnosia. Okay, so that is all about the functional areas. Okay, then, so suppose if these functional areas are damaged, what happens? The lesions also we have discussed. Usually after 60 to 70 years of age, there are changes in the brain. The prominence of sulci may not be seen very clearly due to cortical shrinkage. Gyri get narrowed and sulci get broadened. Subarachnoid space becomes wider. The ventricles, which are empty cavities inside the brain filled with CSF, the size of the ventricles will enlarge. Okay. So again, you see in this condition, there is slow and progressive loss of memory, intellect and personality. The consciousness of the subject is normal. Dementia usually occurs due to Alzheimer's disease. What is Alzheimer's? We see in certain movies also. Memory loss. The change of normal aging are more pronounced in parietal lobe, temporal lobe, and in hippocampus. The normal brain with Alzheimer's disease brain. So what are the gross changes you are finding? Sulci gyri have reduced and the size of the brain also is shrunken. Okay, then you can see the size of the gray matter is also thinning out. This is the subarachnoid space which is increasing and the size of the functional brain is reducing. Okay, that is. So to summarize, we have seen main sulci, like what are those? This is the lateral sulcus, also called as Symbian sulcus. It has stem, then it has rami, like ascending, posterior, ascending, and the anterior rami. Then this is the central sulcus, also called as Rolando sulcus. We have parieto-occipital sulcus. We have deep indenting on the medial side clearly, that is the calcarine sulcus. We have seen the sensory areas, motor areas, and also, of course, the psychical areas. So we have seen the motor areas like primary motor area, pre-motor area, supplementary motor area, and prefrontal area, isn't it? Then, so we have seen sensory areas also, like primary sensory area, secondary sensory, okay, secondary association and higher association areas. Okay, so primary sensory areas, we have seen somesthetic area, visual area, auditory area, right? So this is all about the functional areas, sulci, gyri. So this is actually very, very important topic, which will help you, the knowledge of this will help you both in anatomy and physiology, and you can write wherever the question comes. Only thing is you have to understand and reproduce your answer. Good luck. Thank you.